You're listening to Llámame Anything. I'm your host, Vanessa Francesca Ortega, and today it's just you and me. I'm stepping behind the mic not to interview someone else, but to share my own story, one that begins in a private healthcare office and is now unfolding into a PhD program. So I want to talk about what it means to navigate healthcare from the inside, what I learned digitizing patient records, and how emerging media is shaping the way we care for each other or sometimes fail to. So let's get into it. Before podcasting, before research, before the PhD, I worked in a private gynecologist office where I helped lead a huge shift, converting physical paper lab results into digital scans. That might sound technical, but let me tell you, this was deeply human work. Every folder, every printed result represented a person waiting for answers. I wasn't just scanning paperwork. I was part of an invisible machinery behind people's care. The process was messy. Some files were incomplete, others were mislabeled, and the stakes were high. One missing lab result would delay treatment. So I created systems, streamlined workflows, and tried to build trust. What struck me most was just the lack of technology. It was how human error, burnout, and old school systems created risk for patients, but also how meaningful it was to be the person fixing that gap. Fast forward to now, we're in a world where your doctor might be texting results or where nurses go viral on TikTok. Healthcare and media are no longer separate. But with all this innovation comes risk. We've seen how misinformation spreads, especially during the pandemic. One tweet can undo years of public health work. And we've also seen how the right platform, used well, can educate, empower, and even save lives. I started noticing how different communities, especially Latin families, often mistrust digital portals or don't even know they exist, to be honest. There's a divide between those designing the systems and those expected to use them. What happens when a grandmother can't access her portal? Abuela cannot read it if it's English. What happens when patient care becomes automated, impersonal, or commodified? Or even more commodified. Media has power. And in healthcare, especially in healthcare, there are consequences. That's why I decided to pursue a PhD. I want to study how emerging media, apps, platforms, digital records are adopted in high-stakes fields like healthcare. What motivates adoption? What slows it down? And what do frontline workers think about these tools? Most importantly, who gets left behind when the system, quote-unquote, innovates? It's not just about shiny tech. It's about equity, culture, and trust. It's about making sure patients aren't just data points, but humans, whole humans, with context and complexity. Look, I don't have all the answers, but I'm asking questions. And this podcast is part of that process, holding space for stories, complexity, and connection. If you've ever felt lost in the healthcare system or empowered by it thanks to the right tech, I want to hear from you. DM me, email me, send a voice note, leave it as a comment in whatever platform, whatever works. You can find all the links and ways to support the show at tinyurl.com/llamamanything. Your support helps keeps the space alive and helps reduce CO2 emissions while we're at it, so saving the planet is a part of the bigger conversation, one step at a time. Thanks for listening. There'll be a guest in the next one, but for now, stay curious, stay human, and stay connected. Llámame anytime.